everybody for coming out. We know that it's holiday time. Everybody's super busy this time of year, but this is exactly what time of year you need to start thinking about your health. And the reason why I say that is, what do we do to ourselves over the holidays? Don't we just not eat well? We don't exercise.
I eat a lot.
We don't do any of that stuff.
Really well.
I'm talking about eating sugar and eating all that bad stuff that we know is not good for us, and we all come out gaining 10 pounds over the holidays, right? When we first start out here, normally I always have my patients stand up and they just tell us how long they've been under care, what they initially came in for, and what kind of results they've seen so far.
I came in because of my hip. I've got a bursitis, and basically I think the most benefit I've gotten so far is the stress relief. I've gone under quite a bit of stress at work with some of the things I do. I work for the government contractor on military programs, and it can be a bit stressful, all different things you have to do. So just being able to relax a little bit is a great relief and helps in other things too.
Thank you very much, Oscar.
First of all, I'm 69 years old, and I teach line dancing 3 days a week. So I feel like without Dr. Raders, I would not be able to do that. I have, I think of him more like with my car. I take my car into a car mechanic, and that, you know, when something's really bad, they fix it. And otherwise, I take it in for oil change and some things for maintenance. So he's like my body doctor, and keeps with the adjustments, the maintenance, so that I don't have terrible pains. And when something does happen, whether I fall or something else, a big problem, then, you know, I call and he says, get right in here, and we get, you know, I get fixed up, and I'm back to teaching my dancing, which I love. I probably dance 4 or 5 times a week. So thank you for allowing me to dance.
Because I noticed weakness in my upper extremities. I was having a lot of pain in my lower back. I was very stiff despite doing yoga for 4 years faithfully. So as the recommendation of my physical therapist, I started with Dr. Raders, and I honestly say I've improved in my yoga. My back pain is definitely improved.
Tell them who you went and saw.
Oh,
and what you had done. Tell them all
Well,
that.
I've had probably 4 or 5 injections done in my back where they actually put me to sleep, and none of those worked. I saw another chiropractor. He never took x-rays or anything, so I did physical therapy with them. I did the chiropractic adjustments, but nothing was changing because they didn't know what they were looking at.
Amy's a prime example. When you look at the spine, when you look at the curvatures of the spine, when her last chiropractor didn't x-ray her, shame on him. Shame on him. I x-ray all my patients. The reason why I do is because how can I see what I'm doing if I can't see it? How do I know what I'm going to do if I can't see what it looks like? So when we actually took her x-ray, Amy's neck, your neck should look like this with a reverse or with a curve in like this. And that curve should be in between 35 and 43 degrees to be in healthy, normal range. Amy was less than 10, okay? And when your neck curve is less than 10, you're stretching your spinal cord and your nerves get compressed. That's where all the pain was coming from.
And now I'm at the point where I might get a headache once a week. So that's huge considering I was getting headaches every day, all day long. And my upper back pain was continuous. I wouldn't be able to sleep at night. I was on pain medicine, and that still didn't even work. So this is 3 months. Only 3 months I've been seeing Dr. Raders, and I'm like a different person.
Yeah. No, that's awesome. That's awesome. Only 6% of the nerves in our whole body perceive pain. The other 94% control function. So you can be really misaligned and not feel a thing. Okay? And that's a lot of my patients. A lot of my patients get adjustments even when they're not in pain because they want to keep their bodies healthy. They want to keep that pressure off their nerves, and that's hugely important. Okay? We don't wait until our teeth fall out before we take care of them. Now we must not wait until our back goes out before we take care of it either. You take preventative steps to have white teeth, and you must take preventative steps to have good mobility, since the chances are absolutely huge that you're going to live 30 to 40 years past the age of 50. A mother of one of my patients, she brings her family in. said, Dr. Raders is so caring and truly concerned about each one of his patients. He gets to know you on a personal level and has gone above and beyond to care for my family. The staff is amazing and very accommodating. I would recommend RSHC to everyone. My quality of life, as well as my family's, has been improved tremendously since going to see Dr. Raders. She's been with me since I started. You must follow through with your entire recommendation of care. And the reason why I mentioned following through is because we've already lived with the mindset that you only take care of your spine and your joints when you're in pain. So it's going to be easy for us to think that once you get out of pain, you no longer need treatments. The fact of the matter is, if people do drop out after pain relief phase of care, they're never going to change that mobility scale that we just looked at. My nephew actually has Down syndrome, and I donate all the proceeds to this organization because they're totally donation based. Right now, I think we're at about $3,900. We're shooting for $5,000 for this organization. It's a great cause, and all the donation money that if you guys do get signed up tonight goes toward them. It doesn't go to us. It goes straight to them. Thank you very much. Thank you.